disease. You might be interested a little in my story, how I started. I was a Stanford trained MD, and was disappointed in the cure rates of chronic disease in allopathic medicine. And I don't think it's improved over all this time. And I realized that there was no future in that, so I was going to drop out and become community organizer or something like that. Just think, I could have been president. And instead, I started looking in health food stores to find if there was any alternatives that I might not have been trained at Stanford. And sure enough, actually in Colorado, Boulder, Colorado, in a health food store, this gracious lady turned me on to all kinds of alternative medicine, including homeopathy. And long story short, when I saw that we have laws of cure, that was such a radical concept that I decided I'd better learn. So I took the MD course, the National Center's MD course for MDs at Millersville. And that was a 1-month course, which sort of got my feet wet in how to deal with chronic disease, acute disease, and a little bit chronic disease. And then during a National Center conference, George Vithoulkas gave a talk and met with a bunch of us young mavericks back in those days, and gave us a glimpse of what real classical homeopathy looks like. And I bid on that right away, and actually spent a couple of years going and spending a month with him in Greece, and then finally realized that there was only one way to deal with this. So I closed my medical practice and moved to Greece and trained directly with George. I was the first foreign graduate that he had taught. And as a result of that, I spent a lot of time traveling the world and setting up some 4 different schools in different places in the world based on George Vithoulkas' teachings. So I think you'll appreciate the original training that I had back then. That was 49 years ago, like I say, and of course things have evolved since then. But what I was planning to talk about today was antidotes, and if we can get to it, interfering factors. And I know, I understand in your school there's a lot of discussion around antidotes, so that might be a hot topic. But the other idea came up in preparation for this, that because the COVID-19 coronavirus has impacted all our lives so very strongly, that I could also shift gears and talk about that. I am in touch with world leaders in homeopathy, including Jeremy Sher, Rajan Sankaran, Massimo Mangialavori, all of whom have students in China, Japan, on the Diamond Princess actually originally, Iran, and Italy, and of course the United States. And they have now in the range of hundreds of cases, which they're getting very good results with. And I could talk about the remedies that are involved in that. So it depends on what your interest is. You can use the chat box to clarify what your interest is, and I'll just go ahead with the planned discussion. And unless there's a overwhelming interest, I'll change to the coronavirus topic. So the first learning that I had about antidotes was from Vithoulkas. At the National Center Conference, I remember vividly in my mind, there was about a dozen of us young people sitting around in the lobby, and he introduced the idea that there are antidotes, especially coffee and antibiotics he was talking about at that time. And that blew our minds. I mean, none of us with our preliminary training, it was available back in those days, none of us had really focused on that or heard about that. And so we pondered it. I took it back to my practice. I'd already been practicing by that point, probably for about a year. So I had some experience with patients and I was getting mediocre results, as we all do in our early years, of course. And when I introduced the idea of antidotes and insisted that my patients stop using the antidotes, all of a sudden my cure rates shot up dramatically. It was very, very overnight, very impressive. So I then started systematically testing it on my patients, the new patients that would come in, which things seemed to antidote and which ones didn't. Even other patients over time, once they felt cured, they would go back to coffee, for example. And so dramatically overnight, all their old symptoms would be back, and they were convinced that coffee antidoted, and they became true believer homeopathic patients after that. But gradually, I started experiencing other antidotes as well. So I kept records, and my policy in my practice for almost 50 years has been to only include antidotes that I see pretty routinely in my patients on a regular basis, not an occasional story here and an occasional story there. So just to quickly summarize, the main antidotes that I always tell my patients nowadays are coffee, camphor, antibiotics, and then an addition that I'll discuss is acupuncture, which I learned in my own practice with acupuncturists, the best in the country. Also, it used to be that the dental drills used to antidote. That's no longer the case. But the Cavitron, the ultrasonic cleaner, is a reliable antidote. I've seen that over and over again. So that's a standard that I tell my patients. Then if cases really are going haywire, I may ask them about other things. Geothermal baths is a very reliable antidote. Tea tree oil, only in its concentrated form, is an antidote. Electric blankets, if you sleep inside the electric blanket, is an antidote. Cavitron, Cavitron. And then mothballs are a real antidote. I'll tell you a story about that. And then there's a kind of an offbeat thing that's reliable, but you can't do too much about it. And that's these high tension power lines that some people live right underneath or near. And I'll talk about that. So that's an overall quick summary. So I see a few people are interested in talking about COVID-19. Why don't I take about 5 minutes, and I don't want to waste time for other people if they want to talk about more about antidotes. Oops, computer froze? Mine didn't. Anybody having problems with their computer freezing? Okay, so the COVID story, pretty much people know the symptoms. 80% of people have the mild version, which is, in my experience, starts with a sore throat, maybe a runny nose, loss of smell and taste, and then over a span of a few days may go, well, typically or frequently goes into a cough, a dry cough usually, which doesn't get necessarily worse than that, and maybe fever for a day or two, and the fever can range up to maybe 100, 102 in cases like mine. For the mild cases, the 80% cases, the 15 or 20% serious cases, in addition, they get high fevers, severe weakness to the point where they're literally almost bedridden and can't even make it to the bathroom. And that's a serious symptom when that happens. And also shortness of breath, even at rest. Those are signs that people should go to be hospitalized. To talk about the remedies, let me just tell a couple of stories. So Jeremy Sher is giving weekly seminars that you can, there's one even today. He's done it for 2 weeks so far, and then today he'll do another webinar. You can get that at Dynamis, D-Y-N-A-M-A, D-Y-N-A-M-I-S at dynamis.edu. You can sign up for that, and you can see the very thorough work that he does. It is based mostly on cases that his students have taken, and that includes people who have gone to China, who actually went to or treated cases from the Diamond Princess in Japan, other cases in Japan, and then also students in Iran and Italy. Those are mostly Jeremy Sher's cases. He's got, as of last week, it was 75 cases, and the vast majority of those were cured. A few died. And he does a very strict organon-based repertorization, which he demonstrates for you, and you can see exactly the remedies that come up there. In addition, of course, there's, most people are aware of some of Rajan's students in Iran sent him 8 cases, and he prescribed at a distance, just on paper cases, and came up with camphor for all 8 of the cases. And the results there were actually kind of equivocal. Those cases did not get better very fast. But Rajan has been pushing camphor as a genus epidemicus. I've been in touch with Massimo Mangialavori in Italy. He's in northern Italy, and he's had, well, as of a few weeks ago, he had 50 cases, including serious cases, and very, very good results. I'll just tell you the remedies he found in order of frequency. The main one was China muriaticum, which has a lot of headache and a great deal of weakness and cough and so on. And Grindelia, which has a very big cough remedy, also again with weakness. That was his second most common one. And then in some of the cases, he also in Italy found camphor to be an effective remedy. To go back to Jeremy's experience with a lot more cases and his repertorizations, he has sort of broken the remedies down by stages. So if it's a very early stage, it tends to run towards bryonia, maybe arsenicum, at least in the repertorization. He has not seen good results, though, with arsenicum so much. And he found phosphorus and phosphoric acid to be useful in the mild cases. He was also looking at gelsemium. And I'm in the repertorizations, I've also looked at Baptisia and Eupatorium perfoliatum. Though my information is more preliminary, I only have a few cases. Oh, and I forgot one from Jeremy is mercury. He found mercury to be useful. Then in the more serious cases, it does seem to be focusing down on Anemonium tartaricum. And he has some very sophisticated analyses about the meaning of, Jeremy has sophisticated analysis about the meaning of COVID, what it actually means to the human race, what message from the universe at large is giving to the human race. And it comes a lot down to an Anemonium tartaricum picture, which has to do with drowning in the lungs. but an idea of too much overconsumption. The human race has been over-consuming too much and is full up and can't take any more. And that's his sort of esoteric interpretation of the antimonium tartaricum theme in severe cases. So that's a smattering. Let's see, spell. Okay, Jeremy is Dynamis. And yes, Mercury's solubilus so far is the one they've looked at. Also, Mercurius IR is repertorizing high, but I didn't see that he had that many cases of that. Okay, let's see if there's any other. Good, yes, dynamis.edu, it's on there. Okay, let's get back to antidotes then. And if there's a overwhelming request, then I can come back to COVID some more. But that's the summary of what I've learned from these experts and their students and the results they're getting throughout the world. Grindelia is in most kits. You can get it from most pharmacies. So let me tell the story about coffee. What I have learned is that it's not the caffeine that's the issue. So caffeinated teas are fine. One thing I've noticed over time is that ingesting coffee definitely does antidote. Touching coffee antidotes, even a small amount, but smelling coffee does not antidote. This is from vast numbers of cases. I've actually fantasized that I have so many antidote cases that I could literally make a 2 or 3 volume workbook of cured cases where you could study the cases, repertorize them, and so on, and there'd be a separate code for finding the answer, but then proving the point by the antidote. You know, in other words, if they're cured and then they're suddenly antidoted, and then they take the remedy and they have a full relapse, and then they take the remedy again, and it puts them right back on track. That would be a way of kind of proving to yourself that antidotes are real. They're not just fanciful. Actually, just to make a side comment, most other homeopaths in the world, other than Vithoulkas and all of his students, most other homeopaths don't believe in antidotes. I've had big discussions, and they just simply they don't want to believe in it. I think they're afraid it might interfere with business because not that many people would come in. I think that's true. It is a deterrent in practice in my case. But anyway, so years ago, probably 35 years ago or so, it used to be that patients could do Sanka or decaffeinated coffees and not have any problem. It did not antidote. But then all of a sudden, even my patients that were doing decaf coffee were suddenly being antidoted. And a very diligent patient of mine who had that experience contacted the chemist in one of the, I guess, Sanka itself, laboratory, and said, "What's the story here? Something changed in your formula." And he said that there was a research that showed that benzene in rats causes cancer in rats. And so all of the coffee making companies decided in their decaf that they would, as a whole industry, they would stop using benzene to decaffeinated coffee. And that is what happened. They all switched over to steam processing, which we already knew. The Peet's coffee, which was always steam processed, did antidote, but Sanka did not. And then all of a sudden, even Sanka was doing it because they switched over to steam processing. So nowadays, even any kind of decaf coffee, instant coffee, coffee itself will antidote remedies. That's a very reliable observation. To give you an idea of cases that have this experience, I mean, I can tell you one sort of dramatic personal story. I was staying at my brother's, and his dog knocked his coffee cup, his coffee onto the floor, and absentmindedly, I picked up my handkerchief and went to clean it up, and just a little bit on the tips of my fingers was enough to antidote my remedy. I happen to have some cardiac problems. I'm 77 years old, so things do happen. And my remedy is Crataegus, and sure enough, the coffee, just touching it, gave me my angina back within an hour. And I went and took a dose of my remedy, and sure enough, that got rid of the angina, and I've been fine ever since. That was over a year, probably a year and a quarter ago. Now maybe a year and a half ago. So that's a very dramatic example. Another similar story, I had a patient from Canada, actually the daughter of a doctor who had a patient, I think it was lupus or some autoimmune disease. One of his patients was cured, and he was so impressed that he referred his daughter to me, who had a kind of delayed development, retardation, almost an Asperger's, not quite autism type syndrome. And he had tried all kinds of things, alternative medicines, and nothing was working for her. And I took her case. She was definitely slow in school, not able to pick up on things, had a very shy, timid personality, difficult to make friends, mostly because she was ashamed of her lack of intelligence and her failing in school. She was 10 years old. And so, as you would give, I gave Baryta carbonica, and I didn't hear from them for several months. Normally I do a follow-up at 6 weeks, but they didn't even do the follow-up. And so I didn't know if it failed or succeeded or what. And then months later, the mother called and said, that was a total miracle. My daughter has completely blossomed, changed her personality. She's on top of all of her subjects. She's making friends all throughout the school. She's part of a dance troupe. She's doing all kinds of socializing now that she could never do before. It's a complete miracle. And it happened right away, even in the first week or so after starting the remedy. I use LM potencies, and so she was doing in the midst of the 20 days of LMs. And but the reason why the mother called me back was that she's all of a sudden relapsed back overnight, literally back into being in her shell and not able to function. And they didn't have any idea what was going on. So I inquired about the antidotes, and they're all told about this in the beginning. And sure enough, the mother had identified already that a relative had come and visited, and he drank lots and lots of coffee. The daughter didn't drink coffee, but she was, her chore was to wash the dishes, and so she was cleaning the coffee cup. And that's what seemed to cause the antidote. So I said, okay, let's stop that. The mother, meanwhile, had decided that since the remedy worked so well, she would give it again, and she'd give it every day. And this is kind of with LMs, it's not harmful, but it's not the best way to go. So she tried every day for about a week, 2 weeks, I can't remember now. But instead of pounding the LM 10 times the way she's instructed, she pounded it 40 times. I'd never had a patient do that in my entire career. And I've used LM potencies now for about 15 years. I'd never had a patient do that 40 times each time. And she was getting worse and worse and worse. So to make the story even more interesting from your standpoint, I then said, okay, then apparently that many times of pounding the LM is engrafting approving. I assume that you know about engrafted provings. And so have her take a cup of coffee to antidote the proving, and then we'll see what happens. Well, of course, the mother gave 2 cups of coffee, but she did immediately recover and got back to her blossomed self and was doing good in school and, socializing and everything. And so I had her take 1 more dose of the LM potency. And that was, let's see, that was around December. And so far, she's still doing perfectly fine. But that's a good example of coffee antidoting a constitutional remedy, and then also antidoting an engrafted proving, even from an LM potency, which is a very rare thing. I have scads of other stories. I have a guy who I treated for many years for crippling migraines. He was a kind of a mid-level executive in Silicon Valley, and mostly in charge of a shipping department in a large corporation. And he had terrible migraines 2-3 times a week. And he was given natrum sulfuricum, and his migraines disappeared for close to 10 years. Maybe it was 8 years. And but then he lost his job, and he applied to Starbucks to get a job, and he was provisionally accepted. And so he decided he had to taste the different Starbucks products, and immediately on the very first test of Starbucks coffee, he was immediately antidoted. His migraines came back, and I struggled with him. I went up and up and up in potencies, LM potencies, and so on. And he decided, I think, to stay with Starbucks and just use painkillers. So I kind of lost that case. There was another guy, a very dramatic story, young in mid-20s guy who was headed for a heart transplant at Stanford, was treated for cardiomyopathy and cured. So they canceled the heart transplant. And then 10 years later, and this is my record so far in practice, 10 years later, as a NASA engineer in Florida, he was at a party, ordered tea like he always does, but was handed coffee, took a sip, spit it out, and all of his cardiac symptoms came back within 2 hours. And fortunately, he had his LM constitutional remedy, and he took a dose, and that put him back on track. But that's my record, is 10 years. I did keep track back in my C potency days. I kept track for a number of years, and I did find that some people could use coffee after a few years and get away with it. But by 5 years, about 25% of people were still antidotable by coffee. So I've always recommended against coffee. You don't want to be in that 25%, especially in the C potency realm, where a second dose of a C potency given inappropriately timed can actually cause a relapse in itself. So the quandary with C potencies is, do you just give a dose after an antidote, or do you take a chance of antidoting by the next dose, or do you try to wait it out? And my experience back in the C potency days was that if you wait it out, if there's an antidote and you can wait it out, the symptoms are not too severe, then you often, probably half to the majority of the time, people will get over it on their own within 2 to 3 weeks, and you don't have to risk giving an extra C potency. But of course, there are cases where you do have to take that chance and you give it and it works. So that's kind of the story with coffee. The other one is camphor. George did mention camphor, and I do see that in practice all the time. Vicks, Tiger Balm, Noxema, some chapsticks. You have to look on labels. Be careful not to even get a small amount of camphor. Most of my practice in Silicon Valley is Indian, and so there's actually a lot of camphor that they're exposed to. The primary sources are Indian sweets. Quite a lot of them have camphor in them, and also the holy water in the temples in South India has camphor in it. Even touching the holy water or ingesting the holy water will antidote the remedy. When they do pujas, the cone incense usually, I think, has camphor in it. So handling it, and of course ingesting it, would antidote. But smelling it for the puja does not antidote. So it's the same idea with coffee. Touching it, ingesting it will antidote, but smelling does not. One question that I get from people is, what about nail polish? Nail polish does have camphor in it, but just putting it on the nail itself does not antidote in my experience. I have had a couple of teenagers, they're just playing around and they get it all over their fingers, and sure enough, they were antidoted. So it has to do with absorption in the skin. By the way, other fragrant things do not antidote. Menthol, mentholatum, eucalyptus, mint, those, in my experience, and I've been watching this for nearly 50 years, does not antidote. I saw one woman antidoted by eucalyptus in Greece, actually, when she bathed in a eucalyptus bath at a spa, and so she was antidoted. But that's the only eucalyptus antidote I've seen. And despite a lot of common homeopaths say that mint antidotes, I have not seen mint antidote, even Nature muriaticum. George Vithoulkas himself used to believe that mint would antidote Nature muriaticum for some reason. I have not validated that in my experience at all. So let's see, to give a dramatic example, I had a guy who was a dean of a university, assistant dean of a large university, who was also Indian, and he was a meditator and so on. And he had kind of an irritable bowel syndrome, and his remedy turned out to be arsenicum. And I treated him successfully. He was cured, and he was an engineer and kept meticulous records of his symptoms, you know, the intensity of the symptoms and so on. And he was very dramatically cured for years on end, I think 3 years. And then boom, all of a sudden his curve, you know, fully relapsed. He was back to the way he was, and he couldn't figure it out. And I was learning then about how to manage antidotes with LM potencies. Turns out you need about daily doses for a week to counteract a full relapse from an antidote of any kind. And I didn't know that then, so I was playing with him, trying to straighten it out. And he scoured his cabinets and everything, could not find anything that would antidote. And it finally dawned on him, and he checked it out. When he meditates, he puts a bindi on his third eye. And he had ordered a bindi from a different company. And it was right after that he was antidoted. Just that tiny, and he checked with the company, and sure enough, it had camphor in it. So even that tiny amount of camphor in a bindi was enough to antidote this guy. It was a very dramatic, black and white story. So anybody who doubts antidotes can remember that story. I was antidoted once by a chiropractor. He and I are runners, and we were talking, and I warned him, you know, definitely don't use anything with camphor in it, because he always gives a massage afterwards. And he was talking and just used his usual thing, and sure enough, it had camphor in it. by the time I got out to the reception desk to pay my bill, my cardiac symptoms were back, and it was clearly antidoted by the chiropractor. So you have to be careful about these things. Antibiotics are, George has talked about that as a very powerful antidote. Other allopathic medications, including steroids and blood pressure medications and birth control pills and all kinds of things that have been speculated to be antidotes, in my experience, do not actually cause an instant full relapse, which is my criterion for an antidote, the way antibiotics do. Antibiotics are a real powerful antidote. An interesting observation, though, is that the antibiotics have to be actually treating an actual infection. For example, people who go to the dentist and they're known to have mitral valve prolapse, and so the dentist won't work with them unless they take their antibiotic. Those cases were not antidoted. And the issue there is, I think, unless they have a gingivitis or something, if the antibiotics are preventive to prevent an infection that's not actually there, then it doesn't seem to antidote in my experience. And I've got many, many, probably dozens, if not 100 or so, of such stories like that. But if it is like a strep throat or something, or a cellulitis, where even I say, okay, go ahead and do the antibiotics, or a tooth abscess. I was antidoted once when I had to take antibiotics for a tooth abscess, threw me in the hospital after the first dose of antibiotics. So antibiotics are a very real antidote, no question about it. Acupuncture is not something George mentions, but it's something I experienced. I was friends with the best, well, many, many decades ago, the best acupuncturists in the country, and I became friends, and we decided to set up a practice, and thinking that our systems would be very complementary. We use the same laws of cure and same way of looking at the whole person. Worsley trained acupuncturists are very, very similar to our way of thinking in homeopathy. Actually, George and Worsley became friends and did seminars together back in the day. So in practice, though, we discovered right away in the first week that if we mixed acupuncture and homeopathy together, we would be ruining cases right and left. Homeopathy interfered with acupuncture, acupuncture interfered with homeopathy. Moxa and herbs do not antidote, it's the acupuncture, and acupressure actually does not antidote. And then I had one other experience with a kind of famous, he was a famous basketball star who became a sports medicine physical therapist, and he used local acupuncture for sprained ankles and that sort of thing. And he and I worked it out that he could try that, and then I would try to back him up with classical homeopathy if it was antidoting. And we discovered that at purely local points do not antidote, but you have to be very careful about that. If they're at all looking at the whole person or using points that are scattered throughout the body, then that will very reliably antidote. So let's see. Okay, I'm speeding through this, but let's keep it up. So the story about drilling, in the days when the drills were lower speed, I had to search out. There was one dentist who had a high-speed drill in the Bay Area, and I could send my patients to him, and they were not antidoted. But everybody else was being antidoted. There was one other case that really needed dental work, and he located a very ancient drill in Nevada in a museum where the dentist could use that drill, worked on his teeth, and did not antidote. So we were able to identify a frequency range between about 10,000 RPM and 150,000 RPM is the range of drill frequency that will antidote the remedy. That's kind of irrelevant now because practically all dentists are using high-speed drills that are way above 150,000 RPM. So that's that's no longer an issue, but sometimes you'll see that it will happen because they have to, if they're in an awkward position and they have to push very hard, then that could antidote because it goes like that. Then you're in that 150,000 range and that could antidote. Of course, patients can't control for that. So I just say if you go to the dentist, take a dose after as a precaution. The Cavitron is an ultrasonic cleaner that where they just touch the tooth and blast the plaque off. Most people don't like it because it's a very jarring experience, but it's convenient for the hygienist because they don't have to work so hard. That does reliably antidote. So I ask my patients to request manual cleaning where they do scraping and polishing, which is more work for the hygienist. And so far my experience with that is that it does not antidote. I did have one patient just 3 weeks ago who was antidoted even by that, but that's only one patient. I don't count that. But the Cavitron is very reliable, so you do want to try to avoid that. Now to go through some others, geothermal baths do antidote. I know that because I was a doctor to, well, a couple of large, in my early career, a couple of large spiritual communities, one of which was actually on one of these geothermal hot springs baths, you know, these where the activated minerals come up from the bowels of the earth. And it's not the minerals themselves, it's the activation that seems to be the antidote. And so I treated a lot of people in this community and quickly learned that the baths do antidote. And so if people stayed out of the baths, they would get good results. And the ones who would venture into the baths were being antidoted right and left. So it was kind of a controlled experiment in a way. The results were dramatically different, you know, whether they went in the baths or out of the baths. So the idea of just minerals like mineral baths or Epsom salts or things like that, or jacuzzis, you know, that sort of thing does not antidote. It's these activated minerals from the bowels of the earth. And that's true all over the world. Actually, George noticed the same thing in some of the hot springs that are around Greece. Now, tea tree oil is controversial. There's a mixture there. I've always been reluctant to make an issue of it with my patients because so many products and soaps and shampoos and that sort of thing are as a fragrance, they have tea tree oil added to them. And that does not seem to antidote. I have not seen one instance where that antidoted. But some people use essence of tea tree oil, mostly for skin problems or nail fungus problems and that sort of thing. And that reliably antidotes time and again. I have not seen anybody use a product like that and not be antidoted. There's one form of Tom's toothpaste. I think it's Tom's. It may be an Indian toothpaste. I'm sorry. I'm fuzzy on that right now, where they use concentrated tea tree oil. And that does antidote in maybe 3 cases that I've seen, but those are the only ones I've seen. I haven't seen anybody tell me that they're using that kind of toothpaste with tea tree oil and not be antidoted, so I can't really answer that. But you may want to observe that yourself. Electric blankets is something that I discovered very early in my career, mostly with a narcolepsy case that was responding to opium. I mean, pretty straightforward remedy, but in the winter he would be antidoted, and his narcolepsy was back full force, and that was in my C potency days, so it was a real problem, go up in potency, what kind of timing and all that kind of thing. Very big problem, until a roommate of his who was an electrical engineer said, you ought to stop using the electric blanket. Maybe that's interfering with your electromagnetic field in some way. And sure enough, when he did that, he responded to a remedy and was cured after that permanently. So since then, even just recently, I have one other patient who was doing very well with rheumatoid arthritis. And actually, her symptoms, the arthritis symptoms, had disappeared. But then in the winter in Reno, Nevada, she was using a electric blanket, and she relapsed. And when I went through the whole list, turned out that was what she was doing. As soon as she stopped that and repeated her remedy, then she was back on track again. And then the final one that I have on my list here is the high tension power lines. You may notice, I've only seen a few instances of this, but it was whole families in 2 different cases, one in Utah and one in Colorado, as a matter of fact. And this is where the family lived in a home right directly below the high tension power line, to where they could literally constantly hear the buzzing from the power lines. And they, when they would go away on vacation and take their remedy, they all got dramatic. This is one family in particular, dramatically better. But as soon as they got back home again, they were doing poorly again. And it was a very consistent thing. Then in the Colorado case, I asked them to do that, to go away. And it was in the C potency days, had them all take their C potency remedy once. And on vacation for a week or so, they would be feeling really good. And then when they got back home, they were worse again. It's still a preliminary because it's only 2 families, but that's a complication that you might want to watch out for in your practice. And we can learn more about that with time. I'm not convinced that's necessarily an antidote, but in cases that aren't doing well and you feel confident in your remedy, maybe sometimes it works and sometimes it doesn't, that would be the situation where you want to check that out. Oh, and I skipped over another one that would be the same idea. Whenever they come home, they're worse again. Or in my Indian patients, frequently when they would go to India, even though they were careful about coffee and camphor and all that, they would still be antidoted. And sure enough, if you inquire, it turns out that they're using mothballs. Mothballs will antidote. The naphthalene mothballs will antidote. And just, I don't know if it has to do with touching or even smelling the mothballs, but I've seen that very consistently throughout my career. In California, they don't use mothballs much anymore, but I bet on the East Coast or northern climates, you might see people doing that more. So that's one thing to watch out for. The first time I learned about mothballs was when I was still in allopathic practice and just learning homeopathy, but I had learned from George, so I was careful about coffee and so on. But there was a very bad, it was similar to coronavirus, it was a very bad flu epidemic way back in the 70s. I was working at Kaiser at the time, and we were just seeing case after case after case, very, very sick people. And Kaiser wouldn't let us do homeopathy. So I had to tell the patients, if they were willing to listen to me, I'd say, listen, I take your case now, and I do that live at Kaiser, and take their case and see the remedy. It was usually, I think, gelsemium. And I have a remedy at home. If you come to my apartment at night, after hours, I'll give it to you. And I kept records. And there was, I believe, I can't remember now, I think it was in the range of 30 cases. Yeah, it was about 30 cases were dramatically cured overnight by gelsemium, except for 4 people. And those 4 people were all in one home. And so I made a home visit, and sure enough, I smelled the mothballs. And I think George had mentioned that to me once. And so I thought, okay, that's it then. That was the mothball story. And sure, that was dramatic. But since then, I've seen that in my practice, especially in Indians when they use mothballs in their home, or they go to India where it's more common for them to use mothballs. So let's see. I have lots of comments here. Here's somebody who had a interesting experience with acupuncture, taking the remedy deeper, overwhelmed, maybe mean a healing crisis, and then antidote by coffee. Yeah, that could be. Infrared saunas do not antidote, in my experience. Yes, I only work with LMs now. I did C potencies for about 35 years, and this frustration with timing of dose and how to deal with antidotes and the dilemma around how to time a dose if there is an antidote just was driving me crazy and preventing cases from going all the way to cure. After, actually, it took me 5 years of experimenting. I mean, there's all kinds of different groups, factions, you might say, throughout the world who have different ways of using LN potencies. So I tried different methods from different places. Germany had a group of people doing it one way. The Netherlands had another. Then there was people in America that had similar different ideas on LMs, and the confusion about plussing of C potencies and LMs and multiple serial dilutions of LMs and so on. It was extremely confusing with LMs. Finally, though, the LM method that I've been using now, I actually learned originally from Valerie Ohanian in Minnesota. She clarified this for me. And I've been using it ever since. And it turns out that there's a group in the Netherlands now who use the LMs in the same exact way, pounding 10 times, taking 7 drops, and putting it in half a cup of distilled water, very important, distilled water, and then taking any amount of that, of the dilution after that. More serial dilutions don't seem to make any real difference, but you can alter the succussions. If somebody's very sensitive to a remedy and they're having a healing crisis, you can get healing crises much less often with LMs, much less often, but still maybe 5% of the time. And that can be mitigated by reducing the number of succussions down from 10 to 8 to even 6. And some people are even sensitive then. And then I just stop the dosing. And the healing crisis passes over, just like with C potencies. So that's a real quick summary of the LMs. But that's how I use LMs. The advantage of LMs also is that patients themselves can take subsequent doses. The dosing is not dependent upon my intervention. In the C potency days, I could only give it when I think it was appropriate. They couldn't take it on their own. With LMs, people can play with it. It doesn't do harm. The worst that can happen if they take it daily forever, which is a lot of Indians are used to doing C potencies that way. And so they do that with LMs. And then what happens is it kind of weakens the effect. It desensitizes them so that when they really do need it, it doesn't work as well. But it's not a harmful effect. Doesn't engraft provings the way C potencies do. And except in the case of that one Russian lady in Canada who for her daughter pounded it 40 times. That's the only time I've seen an engrafted proving with LMs. Okay, so we've used up about 55 minutes here. And it looks like we've used up the interest on COVID. So, and I've pretty much said what I have to say about antidotes. Let me take a couple of minutes and then I'll open it up to questions. Because I did promise to talk about interferences, and I knew as I came closer to the time that I wouldn't be able to give this real justice. But people often are asking, well, what about people who are on allopathic medication? And does that antidote, how does that affect the prescribing and so on? The biggest question probably is around oral steroids. It's true, that's powerfully suppressive, but my experience so far, I have not seen any case where it was an antidote in the sense that there's a dramatic relapse of the old symptoms that had been better before the oral steroids. I have not seen an antidote in that sense, but it does act like a parking brake on the system. It's sort of like if you expect a case to be going at a certain rate of cure, rapid in the first few months and then kind of tail end over a span of many more months, depending on how long the chronic disease has been there. The steroids will stretch that out. It'll just take longer for you to see noticeable benefit. Of course, they get the anti-inflammatory action of the steroid is fooling you because a lot of the symptoms will rapidly disappear on the steroids, and so they get temporarily better. But then, boom, as soon as they're off the steroids and the system, it's worked out of their biological system, then sure enough, they relapse again. So it's kind of a yo-yo effect over time. And the remedy still works over time, but it does take longer. And gradually you can wean people off steroids that way by slowly, if they've been on it for several years for chronic disease, you can slowly wean them down. And then when they get to the point where they're inevitably going to have a flare of their ulcerative colitis or their rheumatoid arthritis or whatever it is, when they have the flare, then I give a dose of the LM homeopathic constitutional remedy and try to help them to ride through that flare. And sure enough, they get through that step. Then they reduce their steroid a little bit more. They have another flare. We give them the remedy again, and you sort of ratchet them down that way. It's a big project, and every case is very different. It's hard to generalize on how it's going to go. It depends a lot on how long they've been on the steroid, how effective it's been, and kind of the psychological makeup of the person, how psychologically dependent they are on the steroid itself. As far as birth control pills and so on, I have not seen that actually antidote remedies. I've seen a number of instances where people are doing well, but they've got a remnant of their chronic disease. It just seems to hang around forever. And they themselves decide for whatever reason to go off birth control pills, and boom, all of a sudden that remnant disappears. So again, it's a parking brake kind of phenomenon. Things like blood pressure medications, arrhythmia, anti-arrhythmic medications, and so on, they don't really interfere very much in my experience. Thyroid, I'm constantly getting people off of thyroid medication. And the way I do it is I try to find the remedy. And once I see that the remedy is working, and I'll give it even an extra, it depends on how long they've been on it. But let's say somebody's been on thyroid medication for 10 years, 5 years, 20 years. then I'll give it a few months to make sure the remedy is stable and it's working. Then I'll sneak them down off the thyroid medication. And typically around 6 to 8 weeks, they will have a dip, and it'll be measurable by blood tests where the TSH will shoot up even up to 150 and so on, instead of the normal of about 4 or 5. And you don't panic unless they're really, really severely edematous and their mind is just not working. Twice I've put people back on thyroid in 50 years. And I would say I've got 1 or 2 cases a week of people that are unnecessarily on thyroid anyway. And so I'm always weaning people off of thyroid. And after the remedy is stable, then you can wean them off. They'll have this dip at about 6 or 8 weeks. They'll get past that dip and then they'll be fine. And they won't need to go back on thyroid. That's a generalization. There are exceptions, but those are the main things on my mind. Let me see. Okay, the idea of impregnating the pellets, you take, actually, technically, you know, I'm not much of an expert on this because that's not the way I've worked. I've been spoiled by my pharmacy. They do it in Hahnemann Laboratories for me, and so I don't do it. But as I understand it, you take, and you folks probably know more about this than I do. Take a mustard seed size of the remedy, and then you put it in a certain amount of water, and it should be distilled water. And that part I'm fuzzy on. And then you can make up you make the 1 to 50. I guess that's where the 1 to 50,000 dilution comes. You calculate the 1 to 50,000 dilution, and that's how you get that first 1 to 50,000 dilution. The way I use it is different than a lot of people with LMs. And like I say, all over the world, there's different ways. But I just start with LM1 in all of my patients, and that pretty much always works. And then after conceivably maybe a year and a half or a year and a half, if they are relapsing and their doses aren't working at LM1, I may go up in potency. I have discovered that if you do it sooner than about a year and a half, you have to be very careful about that. It's almost like a C potency in that sense. If you go up in potency too soon, you can set them back. I've had this experience now for about 4 or 5 years, and I'm very careful about that now. And then if you put them back to LM1, they do better again. But patients are so impatient and want to get better so much faster, and you want to help them, that you do what you can. And so I tend to jump up, and sure enough, then I learn I've made them worse. So I have to go back down. There was one experiment early on in my learning of LMs where I forget whether it was Germany or where that I learned this method. You can just willy-nilly go up in potency on LMs. And people would just order from the pharmacy directly. They didn't even have to get my permission. And they would say, well, I want a little more power. So I'd go up to LM2, LM3, LM5, LM8, LM2. And I had people up to, I think I had one up to LM30, several that were up to LM20. And this is in my learning phase of LMs. All of my patients were not doing well. And I was realizing this LM experiment is really miserably failing. So then what I started doing is I asked all of the patients, when was the last time you felt basically good or that you were on the right track? When was the last time? It almost always ended up going back to LM1. So that's where I learned a huge lesson. And I would go back to LM1, and then I'd stay with LM1 until there's a true relapse a year and a half later, and then I would go up in potency. Then I also learned another lesson, which is validated by Elise Timmerman's group of clinicians, homeopaths in the Netherlands. They use the same method of using LMs, and they discovered the same thing that I did, that LM2 doesn't seem to work very well. If you started with LM1, LM2 doesn't seem to work very well. So it's better if you just go straight up to LM3. And then a softer experience, because we don't have to go up higher very often. LM4 doesn't seem to work as well as LM5. So it seems like even number potencies, if you do have to go up, work better. It's almost never now in my practice, and it's very rare that I go to LM5. I think I have one patient I went to LM7, but it's very rare. Pretty much 95%, or 90% anyway, are at LM1, maybe LM3. We're really racing through things. Thank you for finding a good source on how to prepare LM potencies. Some people like to do it that way in their own practice, but like I say, I'm spoiled by Hahnemann Laboratories that just sends a remedy bottle like this already pre-made, and then I tell them how to pound it, dilute it, and take the dilution from there. Any more questions? Here's a question about a plastic surgeon telling patients to take arnica 1M 4 times after a Botox treatment. Well, of course, the founder, Michael Quinn, the founder of Hahnemann Labs, back when he was alive, he actually did a formal research that was published in, I can't remember which journal, but it was published in a plastic surgery journal, talking about the use of arnica for plastic surgery and how effective it was. And lots of plastic surgeons since then have been using arnica. So yeah, I think that's a very legitimate thing to do. There are times when real specific things can be used in an acute condition like that, where there's surgery or severe injuries or even athletic injuries and so on. Arnica, rust tox for sprains, the first aid remedies. Okay, here's an older question about, for the coronavirus, well, which one is good for the cough? I wouldn't say there's for sure one. It's never like that, unfortunately, in homeopathy. If it's early stage and it's a dry cough and it came directly from the sore throat down into the lungs, phosphorus itself is a good. I wouldn't do it as an automatic though. You want to get as many modalities as you can and try to find the remedy. So don't just go by what I'm saying here. But I would say phosphorus is more common than others. Bryonia, so far in my experience, is also, especially for a dry cough, in flu, it's a very good remedy in general. And I've been using it as a genus epidemicus experiment, and I can't tell you whether it's working or not. But Bryonia is one I would definitely be considering. If there's and there is sometimes with the loss of taste and smell, there can also be a bitter taste in the sore throat. I've seen a number of people mention that. And mercury, Mercurius solubilis, or even IR, according to Jeremy, could be indicated in that particular condition. But I've seen spongia. I mean, lately I've got 2 cases that seem to be responding well to spongia. So it could be almost anything. You have to just do ordinary acute prescribing. But if it's if it's moving into the more serious stage of severe dyspnea, especially dyspnea without exertion, without exertion, where they're dyspneic and choking on their own dry, usually it's a dry cough, but with dry expectoration on which they feel like they're suffocating, then ammonium tartaricum, I would say, is the leading remedy for that idea. And I have already seen myself a few cases where they're that severe, where they can't, they're so weak. In addition, they're so weak that they can't get out of bed and make it to the bathroom without help. And it's almost like muriatic acid, where they can barely lift their head off of the pillow. There, I would be thinking China muriaticum, China, any of the Chinas, phosphoric acid, muriatic acid, with the severe weakness and cough at the same time. So those are all remedies you might consider, and that other good homeopaths are considering throughout the world. What's good for loss of smell and taste? Ammonium crudum. I don't know. I haven't seen that tried. I have no idea. Anything's a thought nowadays. I do not think we've really come upon a so-called genus epidemicus that would work for like 90% of the cases. I think there are stages, and that's Jeremy's way of looking at it in stages, I think is very intelligent. But I haven't found a remedy that seems to run through all the different stages. So another question, if Ignatia is the constitutional remedy of a person, can they take it in LM? Of course, yeah. Anything can be taken in LM. And by the way, in case you don't have much experience, I don't know what your training is or your experience in school with LM potencies. The old way of thinking that that LMs are low potencies and C potencies are higher potencies is not valid clinically. Both of them cure chronic disease at about the same pace, in my experience. And like I say, I've done both for decades. So the pace of cure is about the same in both. I think the rate of cure is higher with LM potencies because it's easier to manage if there's interfering factors. If there's antidotes, if there's other drugs that are in the way, you can give more doses with impunity without real danger with LM potencies. So from a management standpoint, LM potencies are more likely to take a case all the way to permanent cure, lasting cure, and being able to manage interferences. Whereas C potencies is very tricky because the timing of doses is very confusing. It's hard to manage. So have we exhausted all 40 of you? Are there more questions? Maybe I missed some here. Yeah, it looks like that's all the questions. So thank you all for listening. I sort of had diarrhea of the mouth there for a while. Talk about loquacious. I'm actually an introvert, believe it or not, but you get me going and I can talk almost forever. So thank you for your attention and your interest, and please be diligent about treating all the COVID-19 cases, because homeopathy has the opportunity, like it has throughout history, to cure this in a dramatic way. much more dramatic than what the medical system and the government are able to accomplish on their own, for sure. So the more of us that are out there prescribing for people at various stages of this disease, the more homeopathy will be on the map. So thank you very much for your attention. Bye now.